We want Oklahoma to be the most pro-life state in the country.
While the battle over abortion access is playing out at the state capitol, it is a debate that has also spilled into the medical community. The new Oklahoma law means the state will have one of the strictest anti-abortion bills in the country, though Trust Women Women's Health Clinic says there are more similar bills in the works.
Maybe more pressing of a concern are the SB 8 style bills that are going through the chambers right now.
House Bill 4327 outlaws abortions after conception, unless it's to save the life of the mother or the pregnancy is a result of rape, sexual assault, or incest. And Senate Bill 1503 is the new Oklahoma Heartbeat Act. Right now, some states still offer abortions up to 20 weeks, including Oklahoma, which makes Oklahoma and even Kansas places where women can choose to end their pregnancies.
Do you think that it will kind of ripple effect to other states? Like, since you are based in Kansas, you have a Kansas clinic. Have you seen an influx of patients already with just, in the week that it's been, approved?
No, we've seen an influx of patients in the 7 months since SB 8 has been in effect. Beginning the day before September 1st, August 31st, when SB 8 went into effect, our phones started ringing and they have not stopped since. We average over 500 phone calls a day to our clinics. Sometimes we're reaching 100 calls an hour. Both of our clinics are now majority out-of-state providers.
Some Oklahoma hospitals are in strict opposition to abortion, and in the U.S., hospitals that advertise themselves as Catholic, like Mercy and St. Anthony's, must follow a set of medical directives written by the U.S. Conference of Catholic Bishops. According to the Ethical and Religious Directives for Catholic Healthcare Services, it says, quote, Catholic health institutions are not to provide abortion services, even based upon the principle of material cooperation, end quote. And on Mercy's website regarding abortion, it states that contraception and termination of pregnancy are not provided, and also states they will instead provide counseling and clinical services to help a woman with her final decision. This can in turn lead to an increase in pregnant people traveling out of state to get abortions.
Even if Roe v. Wade is overturned, what is your prediction for the future in your professional opinion?
What we are seeing in the region in states like Texas, Oklahoma, is what happens when you choose the other path. When you force people to leave their communities during a pandemic, when you create a situation where being pregnant is punishment for having sex, right? When you are saying to people that they're forced to bear children that they don't want or that they can't care for. There's no given future for this. It's a matter of we're going to have to choose what really matters.
In Oklahoma City, Eden Jones, Studio Central.